Hello, this is Dr. Grande. Today's question is, what is rational emotive behavior therapy, otherwise known as REBT? REBT is a therapeutic modality that was developed by Albert Ellis, and it's a version of CBT, cognitive behavior therapy. Cognitive behavior therapy is a general term that refers to a number of specific modalities. REBT is one of those modalities, of course, and cognitive therapy, developed by Aaron Beck, is another. Those are really the two most popular versions of CBT, although there are many other versions of it as well. REBT is based on the idea that cognitive, affective, and behavioral processes can be manipulated to reduce symptoms. Now, Albert Ellis refers to the affective processes as emotive, hence the name Rational Emotive Behavior Therapy. Another key component is the idea of perception, that circumstances don't cause symptoms, rather individuals' perception of circumstances cause symptoms. There is a limited ability to control what happens in life, or sometimes no ability to control what happens, so what really matters is perception. We perceive information as either being positive or negative, or helpful or unhelpful, or stressful or not, rather than those events really having those characteristics on their own. So with REBT, you can see there's a bit of philosophy at work. REBT also looks at the therapist as an expert and as someone who promotes rational thinking. So this idea of perception, that's one cornerstone of REBT, and another cornerstone is rational thinking. That rational thinking can eventually change feelings and behavior and thoughts and result in a reduction of symptoms. Now, REBT is considered a humanistic modality. Ellis believed that individuals are goal-directed, and he saw the human condition and therapy in general as positive. Ellis didn't believe in judging the individual, rather he judged the behavior. Now, what's interesting is when you juxtapose the philosophy of REBT, the positive outlook on the human condition, against some of the assumptions that Ellis made in terms of his theory, that human beings were inherently self-defeating and inherently irrational. Not only that, he believed that as part of the human condition, people held on to irrational beliefs that they learned when they were younger with a lot of vigor and energy, unable to let them go, or not having an easy time letting them go, and this resulted in symptoms as well. So it's interesting how Ellis viewed people as having a positive direction and being goal-directed, but at the same time viewed them as inherently self-defeating and irrational. So an interesting dichotomy there in terms of the philosophy. Now, a key part of REBT is this idea of irrational beliefs, and irrational beliefs leading to symptoms. And one of the sets of irrational beliefs that Ellis believed in was the idea that individuals felt that they needed to be perfect in the world, and that was irrational, that others needed to treat them perfectly and behave perfectly, and that the world in general needed to be perfect. So Ellis really honed in on statements made by clients that involved the word must or should. He didn't like these types of absolutes. He believed they were part of irrational thinking. So as a technique to help people to think rationally, Ellis developed an ABC model. A is the activating event, B is the belief, and C is the consequence. So we could think of the activating event as a stressor, and the belief system is what a person uses to interpret the stressor. So a stressful event happens, they're processed through a person's belief system, and then the person reacts, and that results in consequences. Consequences themselves can lead back to an activating event. So this ABC cycle can be destructive, or it could be used for positive outcomes. And that was one of the goals of REBT, is to help transform that ABC model, which is going to occur anyway. There are always going to be stressors, beliefs, and consequences, but convert that model into something positive for the person. Ellis actually had a number of techniques in addition to this ABC model that he used: role-playing, shame-attacking exercises, reframing, which is common in CBT, homework, and the use of humor. So there's a lot of depth and philosophy in REBT. Another key component is insight. Ellis believed that if an individual could understand and accept that the cause of symptoms were in fact beliefs, that eventually the ABC model could be used to disrupt irrational thinking and introduce rational thinking. He believed in order for this to happen, an individual must continually dispute irrational beliefs. So looking at some of the positives and negatives of REBT. REBT does have, in my opinion, a lot of strengths. If you look at REBT and in general all of the cognitive behavioral therapies, thoughts and behaviors are fairly accessible. A lot of modalities involve interpreting feelings, looking back at the childhood experiences and trying to make sense of them in terms of different frameworks. REBT is fairly straightforward. Initially, it's based on what somebody's thinking and what somebody's doing. As I mentioned, those are accessible. Those are easy to see and to work on, although REBT is actually a fairly complex modality. REBT, and again CBT in general, has been shown to be effective, meaning symptoms like depression and anxiety oftentimes are decreased when individuals are treated with REBT. Also, the fundamental piece of REBT is a change in philosophy. The fundamental action is a change in philosophy. So this modality has a lot of range. It can focus at the thought level, the behavior level, and the feelings, and it can also go, in terms of complexity, up to philosophical thinking. So again, there's a lot of depth, and a lot of different people can benefit from REBT because of the range involved in this theory, all the different aspects that are included. One of the key features of REBT that I like, though, is the idea of unconditional self-acceptance versus unconditional other acceptance. I think this point is often overlooked. At the time when REBT was being developed, one of the competing theories, which of course is still around, is person-centered therapy. And person-centered therapy really focused on the idea of unconditional other acceptance, meaning a client could understand from being with a person-centered therapist that another person could accept them. Another person could be non-judgmental. And this is an important step in therapy, in my opinion. REBT, though, took this to another level and included the idea of unconditional self-acceptance, meaning that for an individual to really have the best chance of being free of symptoms, they had to be able to accept themselves unconditionally. So other people unconditionally accepting them is good, but if somebody can unconditionally accept themselves, that's really better. And that's a feature of REBT. Now, there are other therapies, of course, that use that as well. So what about some of the limitations or negatives with REBT? Well, we see that with REBT, this is again based on the idea that thoughts cause symptoms and that perceptions cause symptoms. And we don't have a lot of evidence to show that this is the way that thoughts and perceptions relate to symptoms. Meaning there is some evidence that shows that disorders can cause changes in thinking and changes in perception. Now, what's interesting about this limitation is it doesn't necessarily mean that REBT would not be effective, meaning certain disorders may cause a change in thinking, but that doesn't mean that if an individual works to change their thinking, they can't lessen the symptoms of those disorders. Meaning the causality here with thinking could work both ways. But still, this is a limitation of the theory. The evidence isn't clear that irrational thinking always leads to symptoms. It might be the other way around in many cases. Another limitation is the idea of the therapist as the expert, and this kind of goes hand in hand with the idea of directive therapy. To some, this may be considered a limitation. I'm including it as a limitation. To others, though, it may be considered positive. A lot of times in therapy, and a lot of the modalities, what we believe is that an individual is able to find the answers they need with some assistance. With REBT, there's a lot of assistance offered. It's highly directive, and it has the therapist in the position of the expert. The therapist knows best. And of course, a lot of modalities, that's not what we see. The therapist is curious, an observer, helpful, but only the client really knows what's going on. So REBT is a little controversial in that respect. So overall, I tend to like REBT. I tend to like many of the cognitive behavioral therapies in general, but REBT specifically. It's practical, pragmatic. It has both a concrete portion and a philosophical portion. And as I mentioned, I think a lot of people can benefit from this therapy. It's not without its limitations or its critics, but I see REBT as a fairly valuable modality in general. I hope you found this description of rational emotive behavioral therapy to be interesting. Thanks for watching.